Hello, I'm Miran Naljayan, the Group Medical Director for Team Galaxy. My goal today is to share with each of you why I am a believer in putting my patients on a home modality. During my fellowship, I didn't have much exposure to home dialysis. The few PD patients that I interacted with were in the hospital setting and extremely sick. After a few years as an attending physician, I was asked to take over a PD program in the inner city of New Orleans. As I had the opportunity to work with the patients, I quickly fell in love with PD because I saw the patients were engaged in their own care. In my line of practice, I'm often asked what prevents end-stage renal disease patients from being able to perform peritoneal dialysis. For PD, very few absolute contraindications exist. Let's address two of the most common misconceptions regarding patients that are good candidates for PD. Let's first address age as a barrier. A patient's survival is very similar in PD and HD. Studies have shown that older patients have seen good outcomes in APD, CAPD, and urgent start PD. APD may provide some benefits for older patients, but overall, age is not a predictor of technique failure in PD. Another great example of a common misperception is that diabetic patients would fail to thrive on PD. While there may be a small benefit of HD compared to PD as a diabetic, it is largely related to underlying existing cardiovascular disease as well as glycemic control. More studies in this area are needed, but patients can do well with diabetes on PD. Partnering with a patient's primary care physician and/or endocrinologist can help ensure the diabetes is well managed. At this point, you may be asking yourself, how does a PD patient's quality of life compare to HD patients? Peritoneal dialysis patients report having improved quality of life and increased satisfaction when compared to HD patients. PD patients have a higher employment rate and decreased hospitalization rate, creating an enhanced feeling of control over their end-stage renal disease. This level of satisfaction, as well as the individualized attention PD patients receive from their dialysis team, leads to higher adherence with prescribed treatments. Here are just a few quotes from our DaVita home patients. The advantages are that PD allows me to be me, to do things that I like to do, and to go places without any restrictions. Another patient shared, home dialysis gives me the opportunity to live like I lived before ESRD. And lastly, we hear from our patient that it, PD, allows me to have the freedom I need to live a happy and healthy lifestyle. Today, I want to conclude this conversation with a request from myself directly to you, a fellow nephrologist caring for our patients. Please consider home for every patient and allow our patients to choose the modality that works best for them. I believe that empowering patients to engage in their own care is truly the meaning of the physician-patient relationship. Following this video, you will find live links to pull up supporting the studies in my message to you today. I encourage each of you to take the time and read over the abstracts. If you have any questions regarding this content, please reach out to myself or your local home divisional lead. Thank you again for taking the time to hear about the importance of PD for our patients.